National Center for Geriatric Health, taking care of the elderly since 2010. The growth rate of elderly population in the country is growing rapidly, leading to an increase of healthcare demands. Dr. Eva Macaraeg Macapagal National Center for Geriatric Health was launched on May 16, 2010. Under former President Arroyo's administration, a 4-story building with 50-bed capacity hospital facility. Formerly called a Singian Clinic, a Chinese-run hospital converted to Tahanan ng Masa. As the years passed, several name changes occurred due to a series of political transitions. While waiting for the enactment of House Bill No. 6245 of 2010, establishing the National Geriatric Health Center of the Philippines, and about nearing 20 House Bill proposals since 2010. Jose R. Reyes Memorial Medical Center became the main hospital to operate its outpatient services designated by the Department of Health. Since then, it has expanded to offer diagnostic tests and specialized services such as cardiology, neurology, ENT, ophthalmology, rehabilitation medicine, and urology. In 2014, the Department of Health has designated the National Center for Geriatric Health, or NCGH, as an extension of the National Kidney and Transplant Institute. However, in 2015, under the Aquino administration, DEMM-NCGH was transferred back to JRRMMC under the chairmanship of Dr. Wenceslao Laudenes. During this time, an increase of geriatric patients seen at the OPD were noticed, and admitted patients were also catered. By 2016, under the Duterte administration, the service expanded beyond geriatric patients to include the non-geriatric dependents of nearby communities. As a result, the name changed to Geriatric and General Health Services. In 2017, from Geriatric and General Health Services, establishing as the Apex Hospital for Geriatric Patients, the hospital was designated by the DOH as Jose R. Reyes Memorial Medical Center, National Center for Geriatric Health, Department of Geriatric Medicine, or JRRMMC, NCGH, DGM. In 2019, while continuing its operations, inpatient services were discontinued due to PhilHealth licensing concerns. However, medical management was facilitated and transferred to the main hospital, JRRMMC. In 2020, to meet the DOH requirements for a Level 1 hospital with specialty training, facility renovations began but were disrupted by the worldwide disease outbreak. Even during the pandemic, essential services continued without interruption. One of the critical services provided was hemodialysis, which catered 25 to 30 elderly patients. Despite the challenges, these services remained a lifeline, ensuring that the most vulnerable received the care they needed. We made significant efforts to protect the health and well-being of our senior citizens. As part of our community assistance program, we provided essential COVID-19 kits, flu vaccinations, and vitamins to safeguard our elderly population in collaboration with the Department of Family Medicine. Established daycare programs to foster a supportive community and provide holistic care. Held collaborative meetings with barangay officials and its healthcare workers in Barangay 873 and 875 in Santa Ana, Manila. Promoted health and wellness among senior citizens through immunization, physical activity, and lay forums. The geriatric team also provides home visits to extend care to patients who are unable to visit the facility. In the year 2021, the issuance of the Department Order 2021-0001 designation of the selected DOH hospital as specialty centers in compliance to the Universal Healthcare Act of 2019 and Republic Act number 11959, also known as Regional Specialty Centers Act. The JRRMMC-NCGH designated as the National Specialty Center for Geriatric Care. Despite the efforts to establish and pursue itself as an independent facility, limitations in space, resources, and accessibility hinder a hospital's ability to function as a fully sufficient and operational standalone institution. Hence, while the aspiration for independence remains a worthy goal, we recognize the need to shift our focus towards enhancing the services we can offer within our current capacity. In light of these challenges, our priority is to solidify our position as a designated Department of Health National Specialty Center for Geriatric Care. This strategic direction allows us to leverage our existing strengths and resources to provide high-quality, specialized care for the aging population. In 2022, as part of its role as an apex and referral facility, NCGH, along with the Technical Working Group on Geriatric Specialty, conducted mentoring and monitoring at Zamboanga Medical Center to assess its geriatric unit. Additionally, they initiated the final development of the Resource Stratification Matrix for Geriatric Healthcare Facilities, a framework designed to guide the establishment of geriatric facilities. In line with the Resource Stratified Framework, we continue to meet the unique healthcare requirements of older adults, such as chronic disease management, dementia care, rehabilitation, and palliative care. To fulfill the requirements of fellowship training, affiliations were established with hospitals such as Tondo General Hospital and the Philippine Orthopedic Hospital, enabling 2 fellows to successfully complete their 2-year training. In terms of human resources, various positions in medical, nursing, paramedical, hospital staff, and finance were filled in accordance with the staffing pattern set by the Department of Budget and Management. JRRMMC began implementing its strategic plan with the launch of an admissions room for inpatients, marking the soft opening of its 10-bed hospital capacity. Surgical management has been upgraded with the acquisition of new equipment. The NCGH launched its first Apex Summit in Geriatric Care, which were attended by different hospital delegates nationwide. A great leap to intensify the services to senior citizens. In 2024, the Department of Geriatric Medicine became the first to offer fellowship training, earning accreditation from the Philippine Subspecialty Board of Geriatric Medicine. To ensure the continued delivery of quality care for geriatric patients, an organizational structure was established. It operates directly under the leadership of Medical Center Chief Dr. Wenceslao Lauderes and is headed by the chairperson and vice chairperson. Designated as the National Specialty Center for Geriatric Care with skilled physicians, nurses, and support staff, and with the increase in number of patients needing geriatric care, improvement in the availability of geriatric services was facilitated. Referrals from JRRMMC for admission, creation of process flow for new patient, from registration, triage, vital signs recording, minimum geriatric screening, and then proceed to the activity area for the corresponding colors. Orange for new patient, red for follow-up consultation with the medical officer, green for follow-up consultation with the geriatric fellow, blue for pricing with the laboratory procedure in the cashier, costing for medication, and assistance with the social service. We also have multi-specialty services, hemodialysis, minor OR procedures, dental, memory clinic, physical and rehabilitation medicine, pharmacy, cardiovascular unit, and diagnostic services. Working on projects and medical management that focus on the complex and complicated medical cases in geriatric patients. Expanded community services were implemented, including general consultations, specialty referrals, and medication prescriptions for relevant medical conditions. Additionally, comprehensive geriatric assessments were provided for bed-bound patients. Where are we headed? Core Info Hub for each specialization. Leader of policy and standard development with the highest level of expertise in clinical services and training. Provide scientific leadership through specialized clinical, public health, and operations research. Provide specialty training and technical assistance to advanced and basic comprehensive geriatric specialty center to strengthen the network of care. Our journey through exceptional service. Our commitment to innovation. This is NCGH. Kumakalinga, umaagapay at umaaruga sa mga senior citizens. Hatid sa inyo ng National Center for Geriatric Health kasama ang Jose R. Reyes Memorial Medical Center.